Yes, please.
Hello, Mr. Amrasekar. How are you doing?
I'm doing well, thanks. How are you?
I'm good. I'm Delanchi. I'm your student nurse today. So before our assessment, I'm going to make some privacy for us.
Okay.
And then I'm going to do my hand hygiene. Okay. First, can you tell me your name and date of birth?
Sure. Yeah, my name is Satya Amarasekara, and my date of birth is on March 22nd, 1985.
Okay. So today we are going to do a head-to-toe assessment for you. And before that, I have some few questions to ask from you. Do you know what day is today?
Yeah, today is May 1st, 2020.
Okay. Do you know where you are right now?
Yeah, we are at home.
Okay. So do you know why are you here today?
Yeah, I'm here for head-to-toe assessment.
Okay, so in here I can see the person is oriented, awake, and his cognitive function is normal, and his oriented type 4. And then I'm going to start his assessment from his face, nose, mouth, throat, and ears. First, I'm going to inspect his face. His face is, the color is brown, which is appropriate to his ethnicity. And then I cannot see any lesions or any abnormal findings. The face is symmetric. His eyebrows, eyes, nasolabial folds, and corners of the mouth is symmetric. So the face is symmetric. And then I'm going to assess his external eyes. His eyebrows, can you move your eyebrows up for me? So I can see his eyebrows went up symmetrically. It's appropriate to his facial expressions. It's symmetric. And then I can see his eyeballs normally align to the sockets, which is normal. And then can you look up for me? His conjunctivas are clear, and his eyelids are pink color, and the sclera is white color. And then I'm going to assess his drainage. Can you look down for me? I can see some moisture and some tears, which is normal. And then I'm going to assess his sinus, the first frontal sinus. Can you feel any pain?
No.
You feel any firm pressure?
Yes.
Okay. And then the maxillary sinus. Feel any pain?
No.
Okay. And then I'm going to assess his cranial nerve number 3, 4, and 6. For that, I'm going to assess the perla. For that, I'm going to assess the pen light. So I'm going to use the pen light. You need to straight your head and look into the. You look at the straight. All right.
Okay.
So his pupils are equally round and react to light and accommodation, which is normal. And then I'm going to assess his diagnostics position test. For that, I'm going to use the pen. You need to look at the pen, and then I'm going to move it around. You need to keep your head straight, all right? You need to look at the pen.
Okay.
So I see his conjugated move. Both eyes are together, so it is normal. And then I'm going to assess his nose. His nose is in midline, it is symmetric, it's appropriately located to the other features in his face. And then I'm going to assess his patency. Can you sniff in for me? Can you sniff in for me? So I cannot see any obstructions, so it's normal. And then I'm going to assess the cranial nerve number 5. Can you clench your teeth for me? Okay. Here I'm going to assess the temporal muscle. I can feel it's very strong equally, which is normal. And then I'm going to assess the sensation of his face. You need to close your eyes and you need to say now whenever you feel this cotton ball, all right?
No, 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 no.
Okay. And then I'm going to assess the cranial nerve number 7. Can you smile for me? Can you show me your teeth? Okay, that's symmetrical. And I want to puff your chest. Can you do this for me? Okay. So I see the air release symmetrically in both sides, which is normal. And then I'm going to assess the cranial nerve number 12, which is the tongue movement. Can you stick out your tongue for me? And then move side to side. Okay, perfect. So it's symmetrical. There is no any loss of movement or deviation inside of the tongue. It's normal. And then I'm going to assess the cranial nerve number 9 and 10. Can you say ah for me? Okay. His soft palate and the uvula is in midline, which is normal. And then I'm going to assess his gag flex. Can you open your mouth for me? Okay. He has, the sound is good, the normal gag flex. And then I'm going to assess his ears. I'm going to assess his external ear. I can see the skin is intact. The color is consistent with the facial color. I cannot find any abnormal findings, no any lesions. And then no any edema or this is foam. And then I'm going to assess the external auditory meatus. There is no any drainage, no any redness, no any edema. It's perfect. And then I'm going to assess the cranial nerve number 8, which is a whisper test. So I'm going to stand behind you and I'm going to whisper some numbers. You need to repeat that numbers while you close your one ear, all right?
Okay.
Can you close your ear?
1, 2, 3.
Okay, the other ear.
10, 9, 10.
Okay, perfect. And then I'm going to assess the cranial nerve number 11. The muscle strength, it's for the muscle strength. Can you move your head to this side, to this side, shoulders to up. Okay, the strength is normal. And then I'm going to assess his lymph nodes first. First the pre-auricular, posterior auricular, and then occipital, and then jugulogastric, submental, submandibular, supraclavicular, can you, okay, and the superficial clavicle, posterior clavicle, and to this side, superficial clavicle and posterior clavicle. Okay. And then I'm going to assess his trachea. It's in midline. It's moves to both sides equally, which is normal. And then I'm going to assess the thyroid. Can you take a seat for me? Take a seat for me. Okay, it's moved normally. I couldn't find any enlargement, so it's normal. And then I'm going to assess his chest and lungs. First, I'm going to start from the posterior. Can you move to this side, the camera? I'm going to assess its posterior. It's brown color. I can see symmetry. I cannot find any abnormal findings like lesions. And then I'm going to palpate. I'm going to palpate the lungs and tenderness. Do you feel any tenderness over here?
No.
Okay. And then I'm going to do the tactical parameters. So whenever I'm touching you, you need to tell me 99, alright?
Okay. 99, 99, 99.
Okay, so I feel the vibration in both sides symmetrically, then it's normal. And then I'm going to inspect the anterior side. Can you move to this side? And then I'm going to inspect his chest. It's symmetrical, it's brown color, which is normal to him. And then there is no any abnormal findings like lesions. And then I'm going to palpate for any lumps, any tenderness. Do you feel any tenderness?
No.
Okay, that's good. And then I'm going to do the tactical parameters. Can you tell me again? You need to tell me 99 when I touch you, right?
Okay. 99, 99, 99.
Okay. And then I'm going to auscultate his lungs. Here I'm listening to his resonance. I can't find any abnormal findings like switch sound. Can you move your hand to the up? To the other side, to the up. Okay. And then I'm going to do the symmetrical expansion. Can you stand up for me? To the back, to the camera. All right. Can you take a deep breath? Okay. Again, can you take a deep breath? Okay. To the front. Can you take a deep breath? Okay. Okay. So can you turn to the back? So you can see his spinal. It's symmetrical, it's in midline, and then I'm going to palpate his spinal. Do you feel any pain over here?
No.
No, okay, perfect. So it's normal, you can sit now. Okay. And then I'm going to assess his heart. First, I'm going to assess the carotid artery. I'm going to palpate his carotid artery. And here I'm finding the pulse are regular. It's smooth. I can rate it to +2. And then I'm going to auscultate the carotid artery from the bell side. Here I'm finding the bruit sound. Okay, perfect. And then I'm going to inspect the precordium. His precordium, I can see the normal respiratory movement in his precordium. And then I'm going to palpate it with my palm. And here I'm going to find any pulsation. I can't find anything. It is normal. And then I'm going to inspect and palpate his apical pulse. It's in 5th intercostal space in left side. I feel it's smooth, regular. I can rate it to +2, which is normal. And then I'm going to auscultate his aortic area. We can find the aortic area in his right side, second intercostal space. And the pulmonic area, it's in right side, second intercostal space. And the earth area and the tricuspid area, it is in lower left side, lower left sternal borderline. And then the mitral area. Here I can hear the S1, S2 sound, the lambda sound. I cannot find any extra heart sound, any murmurs, any clicks. I cannot find any abnormal sounds. No, any S2, S3, S4 sound. Okay. And then I'm going to auscultate his apical pulse for 1 minute. Okay. Okay. So it's 88, which is normal. And then I'm going to palpate his pulse. First the radial pulse. It's, can you? over here. And the brachial part, it's in here. And then the dorsal pedis. Can you move further? It's in here. And then the posterior tibia, it's in here. So I can feel his palms are smooth, it's regular, and I can rate it into +2. And then the femoral artery, I can find the femoral artery in his thigh, and then I'm going to assess the capillary refill. First I'm going to assess the capillary refill in down extremities. So it takes like less than 2 seconds to refill. And then can you give me your hands, please? Okay, it takes less than 2 seconds to refill it. Okay, and then I'm going to assess his abdomen. Can you lay down for me? First, I'm going to assess his jugular vein. For jugular vein, the person should be in supine position. Supine position, he should be in 30 to 45 angle. Can you move your head to your left side? I can see the jugular vein is flat in here, which is normal. And then I'm going to assess his abdomen. First, I'm going to assess the contour. I can see it's flat, which is normal, and then I can see his abdomen is symmetric. There is no any lesions. I can see here a scar. Can you tell me what it is?
Yeah, it's a surgery that I did to remove appendicitis.
Okay, so can I know when did you do that surgery?
About 10 years ago.
Okay. Do you feel any pain or any abnormal findings over there?
No.
No. Okay, it's perfect. And then it's contour, it's symmetric, and I can see one scar over there. Other than that, I cannot see any lesions or anything. And then I'm going to assess his umbilical. It's inverted, it's in midline, and there is no any drainage. And then I'm going to auscultate his abdomen. I'm going to find bowel sound. Okay. So his liver is in his right side on the 11th and 12th rib. His spleen is in his left side on the 11th and 12th rib. And then I'm going to do the light and deep palpation. I'm going to do is rotation movement. Okay. Do you feel any pain?
No.
Any tenderness or anything?
No.
And then I'm going to do the deep palpation. Do you feel any pain?
No.
Okay. And then you can sit down for me. And then I'm going to assess the CVA tenderness. I'm going to give you a tug in your back. If you feel any pain, you can tell me, alright?
Sure.
You feel any pain?
No.
Feel any pain?
No.
Okay. So it's from as it's in kidneys, so it's normal. He cannot feel any pain, so it's normal. And then I'm going to assess the neurological and musculoskeletal system. First, I'm going to inspect his arm and leg. The first arm, it's brown color, and then I cannot find any abnormal findings, any lesions or anything. And then I'm going to inspect his legs. I cannot find any lesions or anything. It's symmetrical. And then I'm going to assess the cerebellar function. You have to repeat with me, all right? It's a finger to finger. Can do it. Okay. And then finger to nose. You need to touch my finger and then touch your nose. Repeat it. All right. And our RAM test. You need to tap your knees like this. And the heel to chin test. You can do like this. Yes. The other side. All right. So I can see it's equal. It's quick. So it's in normal. It's in normal range. And then I'm going to assess the light extremities touch. For that, I'm going to use a cotton ball, and you need to close your eyes. And whenever I touch with the cotton ball, you need to say now. All right?
Now. 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 Now.
Okay, perfect. And then I'm going to assess his range of movement, which is arm and the muscle strength. First the neck. Can you repeat me? All right. This side, to this side, this side, to this side, and rotate. Okay, perfect. And then the elbows. This to your side. Okay, to this way, and fold it. Can you take a pose to your side? Okay, and then your legs. Can you stand for me? All right. I'm going to move your legs to this side, this side, this side. No. Okay, and to this side, this side, this side. Okay. Right. Okay, and then can you give a pose to your middle side? All right. Can you give a pose to your middle side? Okay. Can you stand up for me? Okay. Turn your leg to this way. This way, this way, this way, this way, this way, this way. All right. So this is the end of our head to toe assessment. Can you sit? Do you have any questions to ask from me?
No. Thank you so much.
Thank you.